My name is Raviender Bukkapatnam. I practice in Tampa, Florida. I was actually born in Miami and grew up in Florida, but I've lived in the Tampa Bay area for the last almost 20 years. I did my undergraduate degree at Duke University and then went to medical school at University of Alabama at Birmingham. I then came to Tampa, Florida, where I did my residency in urology at the University of South Florida. Finally, I completed my fellowship in Voiding Dysfunction and Female Urology at UCLA. I chose my specialty because urology was an interesting mix of patients where we have acute care issues and then more chronic relationships that we build with our patients. It's something in medicine that I always wanted to be a part of a patient's life for a long term and not just in episodic care. And so urology really gave me the chance to be able to help my patients both in a very short time and also for a long relationship. Within urology, there are some areas that particularly interest me, and this really started for me from the time I did my fellowship. And in urology, voiding dysfunction has played a big part of what I aim to help my patients with. In addition to this, cancer and robotic surgery, of course, has also been a big part of what we do. But specific to voiding dysfunction, frequency, urgency, incontinence, stress incontinence are some of the things that we particularly take great care to make sure we get the highest end outcomes. Furthermore, I think that neuromodulation is something that I have felt that has really changed patients' lives. And so this tends to be a focus in my practice. When I talk about my specialties and the kind of patients that I take care of, we often talk about men's health and women's health. And to me, really, it's more about the specific conditions. And voiding dysfunction tends to be overlooked in women frequently. It becomes a diagnosis that's sort of kept in the closet, if you will. And so for me, it's not about men's health or women's health, but it's more about taking care of the condition that the patient presents with. The most important thing that I want my patients to know about me is that I treat all of my patients as if they're my own family, and I truly do mean that from the bottom of my heart. We take care of everyone as if they're my mother or my sister or my father or my brother, and to that end, we're all about the outcome for the patient, and we provide that in a caring fashion. Our practice in Tampa Bay, Florida has become the preeminent urologic practice. We have over 30 urologists in the Tampa Bay area, and we continue to grow through the state of Florida. Our motto is quality. Our motto is care specific to the patient. We do everything we can to provide the best outcome. And as a large group, we feel that we have the ability and the mechanics and the support from all the people around us that enable us to deliver on this.